Back to Central Valley today. So we are in the middle of flu season, so now is the time to be proactive about you and your family's health. So I am here with Dr. Gregory Williams, Chief Medical Officer with United Health Centers, and we're actually at the UHC admin office today. So this is how you continue to serve all of your locations, more than 30 in the Central Valley. So these are all the people behind the scenes doing all the work. But let's talk about preventative medicine. You know, we're in sort of flu season. There are some other contagious diseases that are being passed around people right now. How does UHC help with preventative medicine and help prevent colds and flus during this time of year?
Yeah, that's a great question. So we offer vaccines. Vaccines are really helpful at preventing illness. And so we have the COVID-19, RSV, and influenza vaccines for our patients. And that not only will reduce the likelihood of getting infected, but more importantly, if you do get infected, you're less likely to have a severe case. And so that's a really good preventative measure. We also will recommend good hand hygiene and wearing masks that help to also reduce risk of exposure.
How does UHC fit in to the communities that they're serving? Because a lot of times it's hard to get people to create a relationship with a primary care doctor so that they are doing these preventative measures. How do you guys educate the communities that you're in, and how do you try to fit in so that people are coming to you before they're really sick?
Yeah, and so we have a creative team that does a lot of work in the media and then also on social media as well, putting out information for the community. We also provide patient education at our clinics, so when a patient comes in to see a provider, they will get paper information that they can take with them to read about many of these infectious diseases and many of the chronic diseases as well. We want patients to have access, so if they need to be seen, they can come in even as a walk-in. They don't have to have an appointment, and that's also really helpful at improving their access to care, and then they can be educated at the same time. So
we were just talking about that. So how does the appointment and scheduling process work? I know sometimes when I want to see my doctor or when I want my yearly well woman exam, I have to wait a long time. How do we schedule? How do we make sure that we're getting people the care they need as soon as they need it?
Yes, and so what we do is we have a call center that is open from 7 a.m. to 9 p.m. And so essentially all day and almost all of the night, a patient can call in and get scheduled for an appointment. But we don't require appointments. You can actually walk in, you and your family, and be seen that same day, because at UHC, we don't turn away walk-ins.
I love this idea because it makes it so much easier and so much less stressful. And there are so many other barriers to getting health care. And one of the biggest ones is just finding time to make that appointment. You guys also do a lot of other things to sort of knock down barriers to health care. You do transportation and things like that. How do you help people who maybe are in the most rural parts of the Central Valley get access to your health care?
We understand that, as you mentioned, there are many barriers to accessing care, and as you mentioned, transportation is one of the big ones. So we have transportation that's free of charge for our patients, and all you have to do is schedule an appointment, let us know ahead of time that you will need transportation, and we can get that scheduled for you. And it's a round-trip transportation to and from the clinic, and it makes it really convenient so that you don't have to find outside transportation.
What's the overall goal here at United Health Centers?
We are looking to care for the entire person, the entire family, and do so to the widest range of patients, irrespective of their primary language, their country of origin, their educational or social status, and we want to reach everyone as best we can.
Well, you really are far-reaching in the community now. I don't think I can pass a corner without seeing a United Health Centers clinic, and they are all beautiful, and they're all well-maintained, and they all provide a level of dignity that you want when you're going to take your family because they're sick or because you need health care. So if we have people out there, they need to make an appointment for dentistry, for primary care, for behavioral care, any of the other services that you provide, how do we make appointments?
Best way would be to call our access number, which is 1-800-492-4227, and you can get scheduled for an appointment.
Okay. Dr. Williams, thank you so much for inviting me out here. The admin office is just as beautiful as every other clinic. We are expecting great things this year, so thank you so much. Happy New Year.
Thank you. Happy New Year.
Coming up next, we are giving your scalp a makeover. We head to Well Rooted Hair and Scalp Clinic to see how they can strengthen your hair. We'll be right back.